and they have like a little tooth on it. So the ones you're going to use are always flat, because if you have a little tooth on the end, it's going to be hard to grab the sutures like this, right? So you're always going to have some sort of forceps, and then you might have like plain scissors, or you might have something like this. These are actually suture scissors, but if you just have plain scissors, it's not a big deal. You're going to do exactly the same thing. You're going to grab usually with your left hand, and then snip with your right, or opposite if you're left-handed. So I don't know if there's a, you want to read through it, you want me to show you, since I think I have 4. Yeah. 1, 2, I have 4. I can do the really embedded one.
Yeah, could you show us?
Yeah, sure, I'd love that. Okay, so can someone read?
The student clearly visualized and inspected the incision site.
Okay, so you're looking for the incision, you're looking for it to be healed. It's going to be a little bit red, and it might actually be just a tiny bit crusty, and that's okay. But if it's super red, swollen, oozy, then the sutures are not ready to be removed, and you'd actually probably tell the veterinarian to come take a look at the sutures. Okay, so you inspected it?
If there were problems with the incision site, the student informed the veterinarian. If there were no problems with the incision, the student removed the sutures. The student used the correct tool to remove the sutures, and the student did not cause unnecessary harm or discomfort to the patient.
Okay, so to remove sutures, what you're going to do is I left these purposely long so they'd be easy to find in this fluffy dog. They're not usually, the tails are not usually this long, but I left them long on purpose so we can find them. I'm going to do this one because it's a little short. So what you do is you grab the end of one of those and you pull up a little bit. You're not going to like crank on it because that's going to hurt them, but you pull up so you can easily then get your scissors underneath. So I don't know if you can see this, but there's like a loop under there. So you pull up so that you can easily get to the suture. And then you just cut. And it comes out. Good job. All right. So this is usually a 2-person job. Sometimes it's really, really sweet guys. They'll just sit there and you can do it. So let's do it first. So for you, probably your left hand, yeah, probably your left hand will be cut.
So, grab the tail.
So first off, what do you have to do?
Oh, you have to check the incision site for like any sign of it's not ready to take out or it's swelling,
And what else?
and oozing, and if it's not healed, and a lot of redness.
Exactly. Perfect.
And then you grab the tail and pull up and take the scissors and
Perfect. Good job.
that. Oh, go next. Okay, so you check if it is okay to take out, and then you grab one side, you pull it up a little so it doesn't hurt.
But you left your right-handed, right? It doesn't matter, whatever you're comfortable with. Usually the least dominant hand is the holder, but whatever you're comfortable with.
So, and then where do you go under, like right?
So you pull, you're gonna wanna pull up so that you can get that loop. You can get the loop easily. You can get your scissors underneath the loop easily. So there's no chance in you accidentally cutting the skin.
Okay, so
The other way.
So yeah, pull it up, grab that, pull up, and then there you go.
right there.